Healthcare reform, run out, fun out. The W-2 interim guidance has been released regarding the PPACA. Beginning in 2012, as a result of the Affordable Care Act, all employers who offer healthcare now need to prepare useful and comparable consumer information regarding the cost of their healthcare coverage. The information will be reported on the Form W-2 that's released in 2013. Of course, there are dozens of ways to calculate different values for employee health coverage. The regulation writers who are responsible for drafting the legislation have been doing their best to draft meaningful language, but figuring out what their long-term scheme is has been difficult. The value of health coverage will permit the IRS to impose the so-called Cadillac Plan tax beginning in 2018. This is a 40% excise tax on amounts exceeding certain thresholds. The thresholds will most likely change over the next 8 years as politics change. The interim guidance from the IRS suggests that they will be using COBRA applicable premium method to calculate the cost. While the method is sound from a black and white accounting perspective, it certainly doesn't tell the whole story. When a health plan is fully insured, the method is solid. It's simply premium plus 2%, because the fully insured contracts must cover the cost of run-out claims, which are incurred during the policy period, but paid after the policy period. But in self-funded health plans, simply adding 2% is only adequate if the contract purchase includes the entire cost of run-out. Well, how much is run-out? I'll tell you after it runs out. There's no way to predict what run-out costs are because those particular claims have been legally incurred but not reported. A small employer who is self-funded could easily experience catastrophic expenses which double the cost of the entire plan all year long in the run-out period. So what do you tell employees? And when the Cadillac tax comes around, you won't know if you're in the Cadillac plan until after all the claims have been reported.